Yes.
Hi, my name is Sophoni Alexandre. I'm going to be your nurse today.
Okay.
Is your name Jacqueline Delsey?
Yes.
And can you tell me your date of birth?
April 15, 1962.
Name and date of birth matches the wristband. So today I'm going to be doing a head-to-toe assessment where I'll be inspecting your head, listening to your heart and lungs, palpating your abdomen. At each point of the assessment, I'm going to direct you and let you know what I'll be doing.
Okay.
Now I'll be assessing facial symmetry. The palpebral fissures and nasal labial folds are symmetrical bilaterally. Now I'll be testing cranial nerve 5 and 7, your trigeminal nerve and facial nerves. Can you smile for me? Can you clench your teeth? Puff out your cheeks? Squeeze your eyes tight? And wrinkle your forehead. Cranial nerves 5 and 7 are intact. No facial asymmetry, no facial drooping, no abnormal twitching. With your permission, can I palpate your scalp?
Yes.
The scalp is smooth and flat with no abnormal protrusions. Now I'll be palpating your temporal artery and TMJ. Temporal arteries are 2+ bilaterally. Can you open and close your mouth for me? Do you feel any pain?
No.
No tenderness to palpation, no crepitus or limited range of motion. Now I'm inspecting the external ears. No obvious deformities or lesions. I'm pulling and palpating at the pinna. Do you have any pain?
No.
No tenderness to palpation. Now I'm going to be assessing cranial nerves 5 and 7, the trigeminal and facial nerves. Can you follow my fingers with your eyes without moving your head? Very good. EOMIs are intact. Patient is able to follow my fingers without any difficulty or any nystagmus. Now I'm going to be checking the peripheral vision with the confrontation test. Cover your left eye and look directly at me. Tell me when you see my finger.
Yes. I see. Yes. Yes.
Now the other side.
Yes. Yes. Yes.
Okay. Peripheral vision is intact. Now I'm going to be assessing the pupils. I am dimming the lights to check the pupils. Please look straight ahead. Direct and consensual light reflex are intact bilaterally. Look at my finger. Pupils are equal, round, reactive to light, and accommodate appropriately. The conjunctiva is normal bilaterally with no redness or pallor. Now I'll be expecting the nose. The external nose shows no deformity or lesion and is symmetrical. Do you have any pain?
No.
No tenderness to palpation. Can you occlude one side of your nose and breathe normally? Now the other side. Nares are patent bilaterally. Now I'll be inspecting your mouth. Can you open your mouth wide for me, please? Moist oral mucosa. No lesions or dental caries. Can you say "ah" for me? Cranial nerve 10, the vagus nerve, is intact. The posterior pharynx appears normal with no redness, swelling, or exudates. Can you stick out your tongue for me? Push it to the right, to the left. Okay, good. Cranial nerve 12, the hypoglossal nerve, is intact. Now I'm going to be assessing your thyroid gland. Do you mind turning this way? I will locate the thyroid gland at the midline of the throat. Can you swallow? With my right hand, I will displace the thyroid to the left and palpate the left side of the thyroid with my left hand. Can you swallow? Good. Now with my left hand, I will displace the thyroid to the right and palpate with my right hand. Swallow. Do you feel any pain?
No.
No tenderness to palpation, no enlargement or palpable mass. Now I'm going to be assessing your lymph nodes. Using gentle circular motions with my finger pads, I will lightly palpate the pre-auricular nodes, the posterior auricular nodes, the occipital, the jugular digastric, the submental, submandibular, the submental, the superficial cervical. Can you turn your head? The deep cervical chain, the superficial cervical on this side, and the deep cervical chain, the posterior cervical. And can you shrug your shoulders up for me? The supraclavicle nodes. Did you feel any pain?
No.
So no tenderness to palpation, no lymph node enlargement. Now I'm going to be palpating the carotid arteries, one side at a time. Pulses are 2+ bilaterally. Now I'm going to auscultate the carotid artery. With the bell side of the stethoscope. Can you hold your breath for me, please? Again. No carotid bruit appreciated or any abnormal vascular sound. Now I'm going to be examining your heart. The heart can be examined in the supine position, the left lateral decubitus position, and sitting leaning forward. I'm going to check your pulses. Come closer. Come closer. Radial pulses. The dorsalis pedis pulses. And the posterior tibialis pulses. All pulses are 2+ bilaterally and symmetrical. Now I'm going to be auscultating the heart. The S1 is best heard with the diaphragm at the apex of the heart, and S2 is best heard with the diaphragm at the base of the heart. S3 and S4 are best heard with the bell, with the patient lying in the left decubitus position at the apex. First, with the diaphragm, I'll be listening to the heart sounds. The aortic at the second intercostal space at the right sternal margin. The pulmonic at the second intercostal space at the left sternal margin. The urge, third intercostal space. Excuse me. The tricuspid, fourth intercostal space. And may I move your breast to listen to your heart?
Yes.
And the mitral at the fifth intercostal space along the mid-clavicular line. Heart sounds are normal S1, S2, with no murmurs, rubs, or gallops.